I'm Jeff Kenkel, and I'm a plastic surgeon here at the University of Texas Southwestern. And I wanted to first congratulate you on your weight loss and thank you for coming to see us here at the university. We have a great team that's dedicated to your safety and well-being and will help you achieve your goals. We all are aware of the positive effect of weight loss on one's body. This includes obviously an improvement in health, wellness, and physical activity. In general, weight loss patients are extremely healthy and really good candidates to undergo surgical procedures to remove some of the excess skin as a result of such dramatic changes in weight. As a general rule, we don't operate on smokers. Smoking can have many different effects on our body, but from a wound healing standpoint, it can severely compromise your ability to heal and to fight infection. We do know and recognize that these are big operations that do put you at somewhat of an increased risk, which we'll discuss in a bit. But it's also important to recognize that we don't perform extreme makeover surgery here. We just don't feel that's safe and in the best interest of patients. So in some cases, it may require you to have 2 or even 3 procedures in order to achieve your goals. In general, most of you are experiencing skin laxity as a ramification of the significant weight loss that you underwent. And with that, you are experiencing potentially some hygiene issues as well as some difficulty with some of the clothing and activity that you would like to proceed. Unfortunately, the skin has been permanently damaged by the weight changes that you've undergone over the many years. Once that skin is stretched out, it loses its elasticity, and once that's gone, you can't replace that. So what does that mean? Well, that may mean that despite us removing a significant amount of skin in surgery and making things fairly tight, you may experience some laxity or return of laxity as you undergo the healing process and get further and further away from your surgery. One of the other things that many patients do who have undergone weight loss is they restrict their calories, and that's just become almost second nature, and your body can adjust to that. We have to recognize that and correct that prior to your surgery so that you can undergo this somewhat stressful operation and heal to the ability that we would like you to. In order to prepare your body for these types of surgeries, we typically will have you start increasing your protein intake by about 30 grams per day. Now this may mean an extra shake or a bar that you can add to your diet. And by doing so, we can raise the protein levels within your bodies. We are going to want you to be on a good multivitamin and supplement your diet as needed. We will also need to make sure that you properly replace some of the vitamin deficiencies that you may have as a result of weight loss. Vitamins are an essential part of your nutritional intake and help you heal and recover from these bigger operations. So most of the surgeries that we will discuss when you come to see us are going to be fairly big operations, and oftentimes we will combine multiple procedures into one specific operation. And these may take 5 or even 6 hours with you in the operating room. Most of our patients will spend either 1 or 2 nights with us at the Medallion Guest Suites or in the hospital, depending on where we decide would be the best environment for you to have your surgery. Recovery time can vary, but most patients take a minimum of 2 weeks off, but sometimes even 3 weeks, as these are very big operations that do require a significant amount of recovery. We'll restrict your activity to some degree after your surgery, but we'll want you to walk every day. And then starting at about 3 weeks, we'll let you start to increase your heart rate and transition into doing the things that you like to do. As far as driving, once you're off of pain medicine and can move and react quickly, we will let you begin to drive. If your operative plan requires more than a single procedure, we would wait a minimum of 3 months in between those procedures before we would go back to surgery. We really want you to completely recover and be back to the normal activities that you're used to. Now that doesn't mean you have to have that next procedure at 3 months. It can be any time after that 3-month window. Let's talk about your incisions. In general, we place the incision in an area that's going to allow you to achieve the best possible contour change. Sometimes these incisions are in concealed areas with clothing, and other times, say for example in the arms and thighs, these may be more visible incisions. Regardless, over time, these incisions do typically heal quite well, and very rarely do we have problems with unsatisfactory scarring. We close these incisions in surgery with dissolvable sutures on the inside, and then we put some glue and tape on the outside. That glue and tape will stay on for about 3 weeks after your surgery, at which time we'll remove it on one of your office visits. We'll then have you start to massage your incisions with some scar cream that we will ask you to use for the ensuing 6 months. Let's talk a little bit about your activity after surgery. As I had mentioned previously, you'll begin walking the day of your surgery. About 3 to 4 hours after your surgery is completed, we will have you up and moving around. That's always a challenge for some of our patients, and that's why we rely heavily on our nurse support. There's good things that can happen when we start to move you. First and foremost, we want to decrease your risk for blood clots. And then secondly, I think it's effective for you just to get out of bed after you've been laying in that position for a relatively long period of time. Because most of these procedures involve a fairly lengthy surgery, it does place you at a higher risk for developing complications. And we know that patients who have higher BMIs are at a higher risk. And patients who have lost a more dramatic amount of weight also are at a higher risk for developing complications after the surgery. With any surgery, we have risks for bleeding and infection. Those are two things that can happen with any operation that we do. Fortunately, the risk for both of those is quite small. We do have to recognize that some of our patients who underwent bariatric procedures may be anemic or have a low blood count. We may elect to have you see a hematologist to help correct that if that's the situation that you're in. We may even change our operative plan and reduce the time in surgery. As with any surgery, you might experience some numbness at the site that we work on. That numbness gradually goes away with time, but sometimes you could have some persistent numbness that may remain. We are going to put some drainage tubes in certain areas. Those drainage tubes stay in roughly about a week's time. After the drain tubes come out, there is a small chance that you could develop a fluid collection underneath the skin at that site. If that were to happen, we would just take care of that in the office. It may require us to put a small needle into the skin so that we could adequately drain that. We may elect to put you on a diuretic or a fluid pill to help mobilize some of those fluids that you accumulate from surgery. That's a decision that you and I will make, usually within 1 to 2 weeks after your surgical procedure. The most common complication that we see in procedures like this are the minor healing problems. Now, fortunately, most of these minor healing problems are self-limited and get better on their own with a little wound care. We do have to recognize the importance of nutrition, not only before surgery, but also after surgery. Sometimes during that first week, you're not super hungry, so you don't really have that drive to eat. It's going to be imperative that you maintain your protein intake, and oftentimes we'll ask you to take in somewhere between 60 and 100 grams of protein. Now that can be a challenge for some of our patients, particularly in that first week, but we have to recognize that if we don't maintain that protein intake, some of these large incisions are going to be challenged to heal and may have some larger wound healing problems. Because these are big procedures, they do increase your risk for developing blood clots after surgery. Now we recognize this and we do many things to help prevent you from developing such blood clots. The first is we're going to put some compression devices on you prior to you going back to surgery, and then they will continue to work as you're back in surgery. The next thing that we're going to have you do is get up and walk. That's very important, and as I mentioned, you'll be walking about 3 to 4 hours after your surgery is completed. Finally, we may put you on a little blood thinner that we would give to you while you're here within the hotel or in the hospital. This helps, again, decrease your risk for developing these blood clots. Most of the time when we put you on these blood thinners, you don't continue those when you leave. If you are one of those patients who has a medical condition that predisposes you to developing blood clots, we may continue this for a more extended period of time. We also may alter what types of procedures we may do with your safety in mind. The end result that you will achieve will take about a full year. It takes that long for the scars to mature, and in some cases it may take that long for the swelling to go away completely. I hope you are excited about learning more about surgery following massive weight loss. I know many of my patients come to see me and they tell me how good they feel, but then they look into the mirror and they don't see that same type of person that they think they should. In a lot of ways, I think plastic surgery following weight loss can allow you to achieve that goal. Please review the videos regarding the specific procedures that you are interested in learning more about. I think you'll find these to be very valuable and provide you with a bit more detail regarding those specific procedures. I want to thank you for taking the time to view these and for coming to see us at the University of Texas Southwestern Department of Plastic Surgery.